Well, good morning, and first and foremost, I'd like to thank you for having us on the program this morning to talk a little bit about the quality improvement methods and how we apply them here at Chaparral Regional Hospital. Quality improvement plan, how we use them. Well, quality improvement plan has a direct correlation between the level of improved health services and the desired health outcomes of individuals and populations within our communities. Why are quality improvement plans developed? It's very simple. It's with the patient in mind. The reason for it is to provide a formal and consistent process where an organization and its stakeholders use objective measures to evaluate, monitor, and the quality of services that we provide, whether it be operational, clinical, and whichever services are received by the patients. Here at Chaparral Regional Hospital, we want to make sure we have the best access to services. We want to improve upon those services. We want to continue to monitor them so we deliver a consistent quality of service. One way we do this in our plan is we apply a plan, do, study, and act model. We're going to talk just briefly about these components a little bit for a little bit of understanding of it. When we plan it, we want to set improvement goals. We want to be better. We want to improve. So we predict what happens, what may happen, the who, the what, and the how, and the where of it. What data are we going to collect to make these improvements? Once we do that, we do it. We execute our plan. We document our observations and roadblocks that may have come across our way, and we gather as much data as we can. That data is studied and analyzed fully. We compare the data to our predictions, and we examine those learnings. Once we examine those learnings, we act. We decide what changes need to be made in our next cycle, and we implement those changes. So you may ask, what tools do we have for quality improvement? We have to have tools in order to measure our current satisfaction, to put improvements in place to become even better for our patients. We have patient satisfaction surveys. These patient satisfaction surveys, give us the ability to attract and retain patients revolved around vital elements of the patient's experience. Improving our patients' experiences through empathy. As we view patients as unique individuals, this will increase the probability of increased engagement of the patients themselves, their families, and even other caregivers they may have. This increased engagement has a direct impact on our patient outcomes and the overall quality improvement. I've included here a small survey example of the overall satisfaction of our patients when they visit our facility. I want to talk a few minutes here about the potential uses and the benefits of the data. This is key, very important, understanding the needs of our patients. Key uses and benefits of surveying patients for satisfaction. It indicates the loyalty of the patient, and loyalty is driven by patient satisfaction. It also indicates the retention according to technical assistant research programs. If we satisfy one customer, the information reaches 4 others and improves patient retention. It also impacts revenue. In the United States, the loss of patients due to dissatisfaction has been shown to result in losses of over $200,000 in revenue in a facility's lifespan. Satisfied patients result in consistent revenue. Human equity will increase productivity, staff morale, and reduce staff turnover, leads to increased human equity, and is the result of a satisfied patient or patients. We have standards. The International Organization of Standardization, the ISO, the National Accreditation Board of Hospitals, the NABH, and the Joint Commission of Accreditation of the Healthcare Organizations, the JCAHO. They all focus on quality service issues as an industry standard, And the last one is to reduce risk. Patient satisfaction rates have a direct correlation with the reduced risk of medical malpractice. We want to make sure our patients are satisfied and have great outcomes. So in conclusion, there is a direct correlation between quality improvement plans and the level of improved health services and the desired patient outcome. Utilizing a satisfactory patient survey will help improve the quality care of our patients. Surveys impact many aspects of our business, such as malpractice reduction, increased revenues, and physicians and staff productivity, and job satisfaction. All these pieces equate to a better outcome for our patients and improved satisfaction for our patients here at Chaparral Regional Hospital. Once again, I want to thank you for having us on the program here for a few moments to talk about our quality improvement methods here at Chaparral Regional Hospital, and have a great day.